Having healthy vision is something we all want today and for the rest of our lives. So preventing and preparing for conditions such as glaucoma is very important. That's where Newsom Eye steps in. Dr. Vinita Srivastava is here with how she can help. How are you?
Good, how are you? Thanks for having me.
So I'm kind of glad to talk about this because I feel like this is one of those words that I've heard about, that I've known people in my family have had this condition. I really don't know what it is.
Yeah, actually a lot of people don't know what it is, and glaucoma is one of the leading causes of blindness in the world. It affects the optic nerve, which is the cable that connects the eye to the brain, and it's usually caused by high eye pressure. One of the scary things about glaucoma is a lot of people don't even know they have it because there's no symptoms, but it can permanently cause vision loss.
So if there's no eye symptoms, what are people supposed to do?
That's why regular eye exams are so important, to look for the health of the eye, check the eye pressure, and take a look at the optic nerve.
Now, I'm going to say, since I'm obviously not in your field or nowhere near close to your field, isn't the test for eye pressure, is that the one where they blow eye? Or what's the test for? Am I right about that?
Well, a lot of times some people do use the puff of air test.
Yeah.
But it could just be a blue light. It could be a pen. There's a lot of different ways to check the pressure. But that's only one piece of the puzzle. There's a lot of other tests that we do. Looking at the actual health of the optic nerve is very important as well.
Well, I kind of mentioned that people in my family have had this. So, of course, I'm curious, is this genetic or where do you see glaucoma kind of arising?
Yeah, a lot of times glaucoma can run in families, but if you don't have a family history of glaucoma, that doesn't mean you're not at risk as well. If you do have a family history, you should get regular eye exams, starting at age 40.
And I will say, it seems like so many things with technology and medical technology seem to be evolving. What about glaucoma? Because that seems like that's always been around. People always had to deal with it. What innovative treatments are there out there if you get that diagnosis?
There's a lot of, the good thing is there's a lot of treatment options for glaucoma. We have eye drops, we have laser treatments. Here at Newsom Eye, we can combine glaucoma treatments at the time of your cataract surgery in terms of laser treatments. As a glaucoma specialist, I do surgery specific for glaucoma. So thankfully, we do have a lot of options for treatment.
So talking about treatments, does that mean that there's no cure?
Unfortunately, no, there is no cure.
And so anyone, again, the eye appointments are what is key, even if you aren't having problems.
Absolutely. The best way to treat this is prevention, because any vision that you lose, it's irreversible. We can't get that back.
And just out of curiosity, is there anything that you want people at home to know when it comes to glaucoma? Because again, it's something that you hear about all the time, but a lot of people just put on the back shelf because they don't think it could affect them.
I have a lot of patients who come to me and say that they were afraid to come in and they were afraid to know if they have it. And so the most important thing is just coming in and seeing where you're at. Like I said, prevention and early detection is key, so getting those regular eye exams is important. And if you do have glaucoma, we have a lot of available options.
Well, it's so easy to talk with you. You explain it so well. Please come back. And as always, again, you deserve Newsom Eye. So to schedule an appointment, give them a call or visit their website at the information you see on your screen.